Welcome to the first e-learning module in the Domestic Violence Healthcare Toolkit. This toolkit is a program of Nextdoor Solutions to Domestic Violence in partnership with Mayview Community Clinic, with funding and support from Blue Shield Against Violence and Futures Without Violence. In this first module, Domestic Violence, a Primer for Medical Professionals, we provide a basic overview of domestic violence, its impact, and how it relates to the healthcare field, including the Affordable Care Act. At the end of this module, you will have a clear understanding of domestic violence and how you, as a healthcare professional, can help. The National Network to End Domestic Violence defines domestic violence as a pattern of coercive and controlling behavior that can include physical abuse, emotional or psychological abuse, sexual abuse, or financial abuse. For the purpose of this training, domestic violence, family violence, and intimate partner violence are terms that can be used interchangeably. It is important to understand that while the definition of domestic violence is quite broad, only small portions, namely physical violence, sexual violence, and elements of financial abuse, are recognized as against the law and can provide a victim with a legal remedy. Regardless of whether a law has been violated, it is critical that medical professionals act to offer patients the resources they need to optimize their safety and their health. 1 in 3 women will experience domestic violence, sexual assault, or stalking during her lifetime. While women make up 90 to 95% of domestic violence victims, and 85% of victims were female with a male batterer, domestic violence can and does happen to men. We see domestic violence in straight, gay, and lesbian relationships. And while we know that domestic violence cuts across income, class, ethnic, and racial lines, studies have shown that domestic violence is seen disproportionately among low-income women, especially young women of color. And this comes with additional challenges such as limited resources to get help and can carry with it potentially fatal consequences. Domestic violence has an impact that extends beyond the immediate victim. It includes their children, extended family, friends, and coworkers. In short, domestic violence impacts everyone. The Patient Protection and Affordable Care Act, commonly referred to as the ACA, was signed into law in 2011 and requires that screening and counseling for domestic violence be provided at no cost to patients. This set the stage for improving health outcomes by encouraging providers to proactively ask about and address domestic violence. In fact, the ACA highlights the role of the healthcare sector in addressing domestic violence by creating new opportunities for collaboration between healthcare providers and DV programs to better meet the needs of survivors. Resources such as this training will empower you to help your organization to develop such collaborations and improve the overall level of care to victims, survivors, and their families. Let's talk about the causes of domestic violence. Often when we talk about domestic violence, we focus on what immediately preceded a violent outburst. But we must always bear in mind that while there are numerous factors that can contribute to domestic violence, the root cause is always the perpetrator's desire for power and control over their victim. External events such as an economic downturn, housing or job-related crisis, or substantial life change may create stressors, leaving the perpetrator feeling insecure, which may increase the likelihood of abuse as they seek to regain a sense of control. However, these external events are not the cause of the violence. The need for control is. Intimate partner violence, or domestic violence, can manifest in any number of ways. All of them are designed to exert power and control over the victim. While as a healthcare provider, you cannot overlook the impact of physical violence. It may very well be the reason your patient has reached out to you in the first place. However, it is critical to understand there are many ways domestic violence can manifest, and these methods are used often simultaneously to keep the victim under the batterer's control. The accompanying illustration, the Power and Control Wheel, developed by Domestic Violence Intervention Program, helps us to see the many ways an individual may experience intimate partner violence. As you can see, power and control is at the center of the wheel, as it is the core of domestic violence. Similarly, you see that violence, both physical and sexual, are on the outside of the wheel, showing how these types of abuse often accompany other types. Some of these types of abuse include coercion or threats, both making threats and carrying out, and this can include threatening to leave the victim, commit suicide, threatening to report the victim to authorities such as law enforcement, immigration, or welfare, forcing her to drop charges against him, or coercing her to commit illegal activities herself. A perpetrator may use intimidation, making her afraid by destroying property, abusing pets, or displaying weapons. Some abusers employ emotional abuse. This includes putting a victim down, making her feel bad about herself, playing mind games so she thinks she's going crazy, humiliating her, or making her feel guilty. They may use isolation, controlling what a victim does, who she sees, where she goes, and this limits her ability to seek help. Perpetrators frequently use jealousy to justify their actions. Perpetrators may engage in minimizing, denying, or blaming. They make light of the abuse or the victim's concerns, shift the responsibility of abuse to the victim, telling her it's her fault. She caused it. Perpetrators may use the victim's children, using children to relay messages, using visitation time as an opportunity to harass her, or to threaten to take the children away. Male perpetrators may use their male privilege to further abuse a victim by being the one to define the gender roles in the home, being the one to make all the decisions, or treating her like a servant. Lastly, abusers may use economic or financial abuse. This can take the form of preventing a victim from getting a job, not letting her know about the money or have access to family income, taking her money, making her ask for money, or forcing her to have an allowance while he maintains anytime access to funds. Domestic violence has a grave impact on the victim, her family, and the community as a whole. Let's take a closer look. As mentioned earlier, intimate partner violence extends beyond the often short-term physical issue that led a victim to seek healthcare services. We know that survivors are twice as likely to have asthma, irritable bowel syndrome, and diabetes. They're 3 times more likely to have a mental health condition such as depression or post-traumatic stress disorder. They are twice as likely to smoke, become obese, or engage in high-risk sexual behaviors. And domestic violence victims are 6 times more likely to develop substance abuse disorders. In addition, domestic violence greatly increases the risk for unintended pregnancy, whether due to the batterer sabotaging birth control or making birth control unavailable. And these pregnancies are often riskier. In addition to the human cost of domestic violence, there's a large financial cost when we see domestic violence occur. Children who are exposed to abuse are 3 times as likely to use mental health services. The cost for caring for victims in the first year after the initial trauma is estimated to be as high as $7 billion. And the healthcare utilization and cost for victims are up to 20% higher than the general population for up to 5 years after victimization. Right now, you may be wondering how you or your organization can help. The answer lies in screening or assessing patients for domestic violence, collaborating with organizations that can help you best serve patients that identify as victims or survivors, and building a culture of advocacy within your organization so domestic violence is treated with care, dignity, and a patient-centered spirit. We'll have a separate module devoted to screening or assessing, but just to preview. Screening patients even when there are no symptoms present allows for healthcare providers to identify potential victims early, before they have to seek treatment for abuse. Screening allows providers to put patients in contact with services and programs offered both on-site and via partnering agencies. And even if a patient elects not to disclose abuse, you're letting her know your office is a safe place, which may facilitate a disclosure later. If you're able to make information about intimate partner violence visible in your office or waiting room, you're signaling to your patients that you're here to help. Domestic violence is a huge issue, and no one organization can address it alone. To fully support the needs of victims and survivors, it's critical we develop strong, strategic partnerships. Look for the model on how to establish collaboration on the Toolkit website. While collaborative relationships can take many forms, we recommend at a minimum these partnerships include one healthcare program and one domestic violence service provider. True collaboration is not just a referral or even a warm handoff. It is working together to develop capacity in all programs to best serve victims. In this primer on domestic violence for healthcare providers, we talked about the definition of domestic violence and the many ways it manifests in our patients' lives. We talked about the impact both on the victim and on her family and the community at large. We also talked about the impact of domestic violence on a patient's health. We reviewed the role of the ACA and its requirement that DV screening and counseling be provided at no cost to patients, and the importance of regular screening to identify potential victims early. Lastly, we talked about the importance of collaborating with other organizations to provide wraparound services to benefit each patient. We welcome your questions and comments. Please email us at dvhealth@nextdoor.org. On behalf of Nextdoor Solutions to Domestic Violence, thank you for viewing this presentation.